Here we go. I'm just showing an extremely simplified model of why it's important for San Diegans to be very conscious of their activities, to stay safer at home, and if sick, to absolutely self-isolate at home, because these are the major interventions that we have now to shift the curve down so that we can handle the number of cases that we anticipate. If you look at the beginning of the dotted lines here, that's about where we are right now with 226 local cases. And you can see that if the cases double every 3 days, which is what one might expect if there weren't any good interventions in the public, the numbers go pretty quickly past the line that goes that's labeled historical bed occupancy, which is about 50%, and then actually fairly quickly in early or mid-April to the limit of the number of non-federal licensed beds that are in the county of San Diego. And if we look at the green line that's on there, if we can do the proper social distancing, staying at home, and other interventions to make sure that we do not allow communication of this disease between people, you can see a marked shift downward in the number of cases that are reported, doubling every 6 days instead, and we don't reach the historical bed occupancy of about 50% until May, and then we don't exceed the number of non-federal beds in the county until later in May. Now, this is a very simplified model that's based on 20% hospitalizations, people being in the hospital for about 7 days, 9% ICU cases, 1% of patients dying. It assumes that all beds are available for these patients, which is not true. It means that it also assumes that there are no surge additions and no military beds, and that testing is relatively available. I'll draw your attention again now to the red line at the top that says non-federal bed capacity. We know we have 2 naval hospitals, a VA hospital here, so we know that line is a little higher. And we know that the efforts that are occurring within the hospital system by canceling elective surgeries, by realigning services, by establishing outpatient testing facilities, and other important interventions with both supplies and staff, that the number of available beds will in fact go up. We estimate in the state of California that the hospitals themselves will be able to increase their capacity by about 40% if everything is optimized, and we hope that there will be even a higher amount of bed capacity if we get assets from outside the county, such as federal assets. So that red line is artificially low even for what is present now, but will in fact increase with time as the hospitals prepare for this surge of patients. So that's the other aspect of what this chart is showing. Number one, why it's important to push that blue curve into a green curve to buy time so that the red line actually increases and we're able to, in fact, take the load of patients that we are expected to have. I know that's a very simple way of explaining this, but the 2 important points are what you are doing today in your homes by eliminating all non-essential activities and by doing social distancing and the other recommendations that have been put forward, as well as the orders that have been put forward both locally and at the state level, are going to in fact have this effect, and we need to keep with it. It's the main message that we want to give.